Hello everyone. Today we are going to discuss about the brachial plexus. This is one of the most important and the most difficult topic for the MBBS students. So let's see the brachial plexus, right? So I'll start without doing delay. So brachial plexus, it has some components. Let's discuss about the components of brachial plexus. Is that okay? So what are the components of the brachial plexus? For the components of the brachial plexus, I give you one mnemonics. Let's remember this as Robert, Turner, drinks cold beer, right? So these are the components of the brachial plexus. So what are these? This mean R, T, D, C, B. R for root. Brachial plexus has some roots. T, trunk. D, divisions. C, chord. B, branches. Okay, so now let's remember this. The root, we have the brachial plexus. Let's see the mnemonics here. 1, 2, 3, 4, 5. So that it begins from C5 and then goes to T1. How is it? 1, 2, 3, 4, 5. So begins from C5. It goes to C5, C6, C7, C8 and T1. That means it has 5 roots. It has 5 mnemonics here, right? So that's why this is easy to remember. So this is in the normal variants. That means around 70% of the individuals has this one. Some individuals, they have the prefix brachial plexus. That is what? Prefix. Prefix means the root above C5. That is prefix. And some individuals, they have the postfix. They have the postfix brachial plexus. That means root below T1, right? So these are the root, and all of these roots are, please remember, these are the anterior rami from the spinal cord, right? So what is anterior rami, what is posterior rami, what is the gray rami, what is the white rami? To understand this one, please wait for my another video. So we'll make this short video in the next session. Let's go to the trunk. So how many roots we have? 5 roots, right? In the trunk we have the 3 trunks. How many trunks do we have? 3 trunks. These 3 trunks are termed as the upper, middle and lower trunks. Divisions, we have total 3 trunk multiplied by 2 is equal to 6 divisions. That means each trunk has 2 divisions, that is anterior division and the posterior division, right? So that total we have 6. And chords, let's go to discuss about the chords. We have total 3 chords, and these 3 chords are, we give the name according to the position of the second part of axillary artery. Please remember what I explained. These are the MCQs in your board exams. That's why. So the chords are divided, named on the basis of the location of second part of axillary artery. Axillary artery has 3 parts that we will make a video in the next lecture. So these are my lateral cord, the posterior cord and the medial cord, right? The cord which is posterior to the second part of axillary artery is posterior cord, which is lateral to it is lateral cord, and which is medial to it is the medial cord. And branches had some variations over here. So we have the root, we have the trunk, we have the divisions, and we have the chords, right? So from the root we have 2 branches, from the trunk we have 2 branches, from the divisions we have no branches, from the chord terminal 2 branches each chord. Is that okay? Each chord has 2 branches. So these are the the terminal branches I said, and pre-termination, before termination, they have some more branches here. We will discuss that, right? So these are the components. Now let's go and draw the picture of the brachial plexus so that we can remember the longer, because the pictorial image remains longer. So let's make the root first, very fast. 1 2 3 4 5 root we say, right? So we have the 5 roots of brachial plexus that starts from C5, C6, C7, C8 and T1. And let's make a straight line here from the C7, which is in the middle, right? So let's make a straight line going like this, going straight. And from the above two, let's combine them together and then make a straight line this way. And the lower two also, let's combine them together and then make a straight line this way. So we have these 3 straight lines while drawing the brachial plexus. This is the most easiest way to draw. So let's divide this as a robot, trunk, drinks. Let's make a cold and beer, right? So let's make it robot, trunk, drinks, cold, beer. That means the root, the trunk, the division, the chord and the branches. Yes, so we already done with 2 things. Let's see the root already done, C5 to T1, and we are done with the trunk as well. So in the trunk we have done. So how the trunk formed? The upper trunk is formed by the upper 2 roots, right? So this is my upper trunk, and the middle trunk is formed by the single root C7. The lower trunk is formed by lower 2 roots. Let's see here, these are the lower 2 roots. Yes, so this is my lower trunk, right? So after the trunk we said the divisions. How many trunk? 3. Divisions, how many we said? 6, right? So each trunk has 2 divisions we said. So see, one, we consider this is 1 division itself, and we will make 1 more division here. Okay, so 1 more division going like this, 1 more division going like this, 1 more division going like this, right? So now see, we can see 2 divisions, 2 divisions, 2 divisions everywhere, right? So these divisions we give name as anterior and posterior. So let's give it anterior division, posterior division. This is anterior division, this is posterior division, and in the lower trunk I'll make it the posterior division. This is as a anterior division, because it will be easy to draw the picture, right? So now after the divisions we'll go to the chord. How does the chord form? Let's see. The chord is formed by, let's start with the posterior. All 3 posterior divisions, they combine together. See, this posterior division is coming here, this itself is a posterior division, and this posterior division is going here. So there's all 3 posterior divisions going together to form the 1 chord. This chord is called the posterior chord. Which chord is this one? Posterior chord. Why we say this posterior chord? Because this is posterior to my second part of axillary artery. That's why I call this as what? The posterior chord. After that, let's go to the lateral chord. The lateral chord is formed by this upper 2 anterior divisions. Let's see, this anterior division meet with this anterior division here, right? So this and these 2 divisions, they are forming my what? Lateral chord. And now for the medial chord, I have only 1 division remain here. That's my anterior division of my lower trunk, right? So the lower trunk anterior division itself, it forms my what? The medial chord. Is that okay? And these chords continue forward. Now after finishing this one, let's go to the branches. So we discussed the branches. For the branches we will go here. The rule we made 2, no branch. Pre-terminal branch we haven't discussed. The terminal branch is 2 from each chords, right? So we said 2 from each chord, we said like this. These are the branches. Yes or no? So now let's discuss, let's go forward with the branches. Okay, let's see the branches. In the root we said 2 branches, right? So these 2 branches, these 2 branches, one exit from here, one branch is here, the another branch is coming here this way. So this and this, they connect together. So let's see here, these are my 2 branches from the root. After that we said 2 branches from the chord, right? So these 2 branches, one goes like this, one goes like this. These are my 2 branches from the trunk. And then division we said no branches. From the chord, let's see here, this is the chord, and this pre-terminal pre-termination of the cord, we have some branches here. Let's leave it for now. Let's go to the terminal branches first. In the terminal branches, it's easy to remember. This one is going forward straight. This is also going forward straight. This is also going forward straight. So this one which goes forward straight, let's make it as a musculocutaneous nerve. This one which is going forward straight, let's make it as a radial nerve. This one which is going straight, let's make it as a ulnar nerve. Is that okay? So which is straight, we make it musculocutaneous nerve. See, this is musculocutaneous nerve. Why we give the name? Because this musculocutaneous nerve is supplying the upper arm, right? So that means it is supplying my upper arm, the anterior compartment. So it is above, so we can remember like this in the picture, it is above, so it is supplying the upper arm. So upper arm supplying nerve is what? Musculocutaneous nerve. So this way you can remember. And radial nerve is going through the posterior compartment of our hand, the arm, forearm and hand. That's why it is the continuation of my posterior cord, so we can remember like this. And this is ulnar nerve. Ulnar nerve is most medial in our hand. That's why this is going from the medial cord, so we can remember this as the ulnar nerve, right? So one formula I want to give you here. That formula is AMUR. What is this AMUR? AMUR are my 5 branches which supplies the upper limb. So 5 terminal branches of the brachial plexus we supplied my upper limb. These are my 5 branches. So you may be confused over here. We have only 4 letters, but we wrote here 5. So what are those? Where this one nerve hidden here? A for axillary nerve. This M has 2 nerve. One is musculocutaneous nerve. Another one is the median nerve. U for ulnar nerve and R for radial nerve. So that this AMUR, they are supplying our upper limb, right? So we can remember this way. So here also we can remember the formula. Next day I'll make a new video with the muscle supplied. Which muscle do these branches supplies, right? So for now let's remember this one. The upper limb, we have how many nerves they're supplying? The terminal branches of brachial plexus. These are the 5 nerves. They're supplying the upper limb, right? So from these 5 nerves we made here 1 already, right? 2, 3. So what are the 2 more branches? These 2 more branches we can remember like this. So one branch is going from here. This is my axillary nerve, right? And then one more branch remain. This one more branch is from here. From here it is giving 1 up, and from here it is giving 1 down like this, and they meet over here forming a nerve here. This nerve is my median nerve. So that total we have 5 nerve, right? So AMUR. So total 5 terminal branches. Now let's go to the pre-terminal branches of the brachial plexus. So these pre-terminal branches, we can remember the formula as 1:3:3, right? That means the lateral cord I have 1 branch. The posterior cord I have 3 branches, one going like this, one going like this, and one going like this. And then the median cord I have 3 branches, one going this way, another going this way, and another going this way, right? So that 3 branches over here. Now let's name them. The terminal branches we already named, right? So these are the terminal branches we already finished. Let's go to the other branches, the name, right? So from the root we have 2 branches. What are those 2 branches? The name. This one is my dorsal scapular nerve. This one is my long thoracic nerve. Easy to remember. Remember, these are the 2 branches which are coming from the roots. These are the question in the exam. Which of the following nerve are the branches from the root of the brachial plexus, right? So this is a very important question in the exam. Let's go to the trunk. From the trunk we have the 2 branches. So these 2 branches, both of these branches comes from the upper trunk, not from the middle trunk, not from the lower trunk. So what are those 2 branches? So these 2 branches, one is going up, right? So which is going up, we can call this as the suprascapular nerve, because it is going above, that means supra, right? And this is coming down, so let's give it as subclavius nerve. That means the nerve to subclavius. That's it. And then let's go to the pre-terminal branches. So in the pre-terminal branches also we can use a trick, like this is coming from the lateral cord, so we can give the lateral pectoral nerve, right? Lateral pectoral nerve. So this is coming from the medial cord, so we can give this as a medial pectoral nerve. And remember, we have a trick here. all the nerves which come from the medial cord, they all have the the name starting from the medial, right? So this is my one medial pectoral nerve. Another nerve is medial cutaneous nerve of arm. This one is medial cutaneous nerve of forearm. See, medial, 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 they all have the word medial, they all are coming from the medial cord, right? So that we can memorize like this. And this sometimes they give the different name as the medial cutaneous nerve of arm, as a medial cutaneous nerve, or they can say medial brachial cutaneous nerve, because arm is also called brachium, right? And for the medial cutaneous nerve of forearm, they can call medial antebrachial cutaneous nerve, because forearm is also called the antebrachium, right? So they can give the name like this way. And from the posterior cord, we have the three branches we said, right? One is going up, that's why we call this as a upper subscapular nerve. It is going to subscapula. And this one we can say as a lower subscapular nerve. This is going to the lower part of the subscapular muscle. And this one is the thoracodorsal nerve, right? So this is TDN, we say, that is thoracodorsal nerve. So are we clear over this, all the branches? So we have the two branches from the root, two branches from the trunk, and we have the two terminal branches from each cord, and we have some pre-terminal branches from the cord, that is 1:3:3. From the medial cord we have median, 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 the word is there, and from the lateral cord we have the word name lateral, right? So you can remember like this. So these are the branches. Now see, I give you a trick. These two nerve we can remember, these two nerve we can remember, and these last branches which is difficult to remember, I'll give you a trick to remember the branches from the cord, right? So let's see the branches from the cord. We can use the mnemonic, right? So the mnemonic we can use as, for the lateral cord, for the medial cord, and for the posterior cord. Okay, so lateral cord we can give the name as Lucy loves me. Okay, so the Lucy loves me, we have the branches over there. We can see what is the L for. L for lateral pectoral nerve. L for, we can see this is the lateral root of median nerve. See, median nerve has two roots, one root this one, another root this one. This one is coming from the medial cord, so we say this is a medial root, medial root. This is the lateral root. So we can say lateral root of median nerve, lateral pectoral nerve, Lucy loves me, musculocutaneous nerve, right? So that this is my what? Lateral pectoral nerve. This is my lateral root of median nerve. This me means what? Musculocutaneous nerve. That's it about the lateral cord. Let's go to the medial cord. In the medial cord, we can call a mum, right? So mum, if we need something from mum, how do we call mum? Mum, like this we'll call. That's why we have 3 MU again M, right? That means we can simply say M for U. So what are those M for U? Let's see here. M, and this is M, medial root of median nerve, and we have U, ulnar nerve, right? So we can see here, that's my, let's see, medial pectoral nerve. This is my medial cutaneous nerve of arm. This is my medial cutaneous nerve of forearm. This is my ulnar nerve, and this is my medial root of median nerve, right? So this is where you can remember. And for the posterior cord, we have, you know, the unique feature of posterior cord is that posterior cord contains all 3 posterior divisions. That means it is extra than the other cord. So if something is extra and unique, we call this as ultra. What do we call this one? Ultra means exceptional, right? So this is exceptional posterior cord. So it has the ultra branches. What are those ultra branches? Let's see. Upper subscapular, L lower subscapular, T thoracodorsal, R radial, A what is this one? Axillary. So U for, let's see, U for upper subscapular, lower subscapular, T for thoracodorsal, R for radial nerve, A for axillary nerve, right? So today we did the roots, the trunks, the divisions, the cords, and the branches of the brachial plexus. The next day we will learn about the root values, and then the muscle supplied by the brachial plexus. So to follow my more videos, please follow my channel Dr. GP Sharma Ashis. Please follow and subscribe. Thank you.